Okay, let's talk about potassium now. So, potassium is your intracellular cation. So, the major one that is inside the cell. So, potassium is responsible for actions on your muscles, cells of muscles, neurons. A big one about potassium is it controls cardiac rate rhythm and your skeletal muscle contraction and your smooth muscles. So, a big one about potassium is what's it doing to the heart. So, a big factor for watching patients with high or low potassium is what's happening with their heart. Are they having any dysrhythmias from that? So, potassium comes from in your diet dried fruit, vegetables. A real high one is bananas, apricots, raisins. Eating a lot of black licorice can decrease potassium. So, not don't eat a lot of black licorice. Salt substitutes. Elderly patients that have CHF may end up being on a low potassium diet, so they will go out and buy salt substitute in the grocery store and salt substitute instead of the regular salt, which is sodium chloride. Salt substitute is made out of potassium chloride, so that can increase that. So hypokalemia and lower, you're going to have low potassium with that. So it's going to affect your nerve and muscle cells, as I just mentioned. How do you get hypokalemia? Well, if you have too many potassium wasting diuretics, that can cause potassium to be low. If you have a diet low in potassium, that could cause that as well. So low potassium, if patients are prone to that, they need to watch their diet, make sure they have high potassium foods. There are patients out there because of heart failure and the medications they take, they eat a banana a day, so that helps them maintain potassium. So other ways you can, if you got lower potassium, if the patient is on digitalis, digitalis is really toxic if a patient is hypokalemic. If you're also low potassium, you will have GI problems. You might get an ileus in your gut. So that's one thing. So think of muscles, cardiac, if you're low potassium. How are we going to treat that? Well, we're going to treat that by giving potassium supplements that can be taken PO. You can get IV solutions diluted in like normal saline with potassium. You never give straight potassium by a bolus. It's always diluted and given on a IV pump. Hyperkalemia, that's too much potassium. So hyperkalemia, an example of why you might have that, Addison's disease. So you might, if you have that, you're on a higher risk of hyperkalemia. If you're taking potassium sparing diuretics instead of potassium wasting, you could have hyperkalemia. So signs and symptoms of hyperkalemia basically is going to affect the heart as well. So hyperkalemia, you might have a dysrhythmia. If you're hyperkalemia, you're going to have a slower heart rate. You might have a T wave. Your T wave will be spiked. That doesn't make sense now, but it will when we talk about EKGs. Neuromuscular problems, muscle twitching. So if hyperkalemia goes way too high, then a patient could have, the heart could stop beating. Same as if it goes way too low, it can also affect your heart. Only hypokalemia is going to cause U waves. It's called a U wave on your EKG. So that could be a problem. Hyperkalemia is common with patients that are burn victims. Burn victim patients, you kill the cell is destroyed, and it's going to release potassium. trauma as well. So if you're hyperkalemic, how are we going to treat that? Well, we can give patients medicine that'll decrease that. One of them is called K-exalate. It's in the gut. It pulls the potassium out of the gut, and they basically excrete that in their feces. Another kind of thing is we can give patient, if it works, we can give them diuretics, potassium wasting diuretics. That is a good way to get rid of your excess potassium. We can decrease your sodium, I'm sorry, your potassium in your food, so cut back on food that's high in potassium. Um, so calcium, let's talk about calcium for a minute. So calcium then basically, hypocalcemia is low. Um, Certain kind of things can cause that. If you have low calcium, you're going to have muscle cramps, you can have confusion. Calcium is also going to affect your heart as well. Go into cardiac arrest if it's too low. There's two signs when you look to see if someone has low calcium. One is called Shavastic sign, which Shavastic sign is seen if they have a muscle spasm at the cheek when you tap over the facial nerve. Another one is called Trousseau sign. It's basically a carpal spasm after you occlude the blood flow to your hand with a BP cuff for 3 minutes. It causes spasms. So calcium, too much, too low. I just mentioned it can cause confusion, cramps, irritability. Um, it can cause, if you're too low, paresthesias in your fingers. So it's a big thing having to do with your muscles. So patients that may end up having that, for example, hypothyroidism can cause that. If a patient uses way too much phosphate containing laxatives, that can decrease your calcium. If they have some kind of absorption problem, that could be an issue as well. So treatment for this, basically administer oral calcium. I keep saying potassium. Oral calcium supplements. So Tums is a good way to get some calcium. They can drink milk. So milk products are high in calcium. That's another way. You can also give calcium gluconate IV, very slow. So that's something you have to watch if patients have a thyroid surgery. If you have thyroid surgery, they take out your thyroid. That can also affect basically what's going on because now you don't have your parathyroid, so they have to watch that very closely. Hypercalcemia then is basically too much calcium, and that's going to be caused by lots of different things. Maybe you ingested way too much vitamin D. Remember, vitamin D is used to bring in and absorb your calcium. So if they took in too much vitamin D, if they've got a parathyroid, if it's hyperparathyroid, that could be an issue. So signs and symptoms for hypercalcemia: nausea and vomiting can be an issue, muscle weakness, um, depressed deep tendon reflexes. It can also affect your heart. If it goes way too high, you could have cardiac arrest as well. So how we're going to treat hypercalcemia, basically teach the patient not to take vitamin D. If they're too high, stop taking that. We can do loop diuretics like Lasix, and that will correct some of the high calcium. So easy to take it out once it's in there. So hypercalcemia. Hypermagnesemia. Hypermagnesemia. So if you're high in magnesium, The balance of your magnesium is related to your calcium and potassium. They all kind of work together. So these patients, usually fasting or starvation patients, chronic alcoholics, are low in magnesium. Um, we can correct that basically with patients that they eat green vegetables, nuts, bananas. That helps. Um, Chocolate is a good source of that. So hypomagnesemia is going to be, it's going to affect your deep tendon reflexes. They're going to be very hyperactive. Um, it can also affect your heart, so you're going to have dysrhythmia, PVCs. You'll understand what those are a bit later. So counseling patients, telling them to, um, if you're low in it, then you need to help your diet. You can also take, for treatments, you can actually have patients take magnesium. You can give that IM, give it IV. So different ways they can up that. Usually the problem is you need to find out why they're losing it, and that's got to be a big issue. Hypermagnesemia, that's the other issue. It's gone the other way. You got way too much. So this could be done by patients that use overuse of antacids containing magnesium, like Malox, um, laxatives that also are high in magnesium, milk of magnesia, for example. People that have renal failure, or if they have Addison's disease, that's also going to be an issue with hypermagnesemia. So this is also going to affect, same kind of thing, it's going to be hypoactive, deep tendon reflexes. It could affect your respiratory hypotension, also going to cause cardiac arrhythmias like bradycardia, heart block. So how are we going to treat that? Well, let's not let them take any magnesium containing antacids or laxatives. So we increase fluids. A patient should be able to, if they got a good kidney, to pee out some of their magnesium, so that works. Some calcium, interesting, calcium gluconate is an antagonist. So in an emergency situation, we give that to the patient, and that will decrease their magnesium. So that's another way of doing that.